My name is Anthony Weaver, and I'm a Lead Risk Assessor with the Lead Paint Detectives based in Toledo, Ohio. I'm interviewing Dr. Marilynne Wood, an expert in childhood lead poisoning. We are answering questions surrounding the topic My child has lead poisoning. What do I do now? In part three, we talk about once my child has tested positive for lead poisoning, how long does it take to reduce the levels once intervention techniques and plans have been started? Will a child be able to catch up to his peers once treatment has started? And later life potential. Let's get back to my interview with Dr. Marilynne Wood. Now, Dr. Wood, if a child tests positive for lead poisoning, say it's 6 micrograms per deciliter, what should a mom and dad expect in the reduction in levels once they have started actively treating this child?
But we'd want to check them again, do another venous in 3 months and 6 months. Sometimes at 3 months, maybe it's gone down a little, maybe one, and that's not to worry. At least it's going in the right direction. And in 6 months, we should see maybe even down to 3 or 4.
Okay.
That it may go down that far, especially if they're following good nutrition aspects on a vitamin, empty stomach. And I think too, these children do need extra help with their homework, extra help in school.
Okay.
Because they'll have some difficulty keeping up with their peers, but they should see some differences. And you want to have a good relationship with your clinic doctor, your pediatrician, that they can keep an eye on this, that it's going down and not. And
We
not,
want to make sure it's definitely going
it's
down, going in the
down.
right direction, which be going down.
Right.
Okay.
Right. And if you follow the interventions, really, it helps. Hand washing and the avoiding an empty stomach and nutrition.
So we've talked about this a little bit as well. We just talked about this. So my child's blood lead level is elevated, and so I've already mentioned they're going to have a little bit of trouble in school. They won't be able to quite keep up with their peers. Following directions, staying on task, some behavioral problems. So you're also saying, once we get in there and start treating that child, we're able to reduce those levels a little bit, and some of that will go away?
Yeah, they should have a better time in school.
Okay.
Staying on task. They really have some ADHD behaviors, and many of these kids, because the teachers say, I cannot have them back in the classroom. The parents are kind of caught in the middle because the physician doesn't want to put them on meds, but they are on Ritalin and others for ADHD because to settle down and stay focused in the classroom. And sometimes when we see the lead levels go down, then they don't need the meds. And
okay.
It's good if we can keep them off the meds.
So are you finding doctors are sometimes mistaking ADHD and giving them other medications for other problems and not treating the actual lead poisoning?
Right, they may not be aware that really that lead poisoning is the factor. And even before I got into this, and parents, we really don't know that this could be a factor.
Okay.
It's made a big difference in children's lives as far as staying on task. Usually in preschool, kindergarten, and first grade, they can kind of get by. But when they're reading and doing math problems, they feel so defeated because they can't keep up with their peers. They feel they're not as smart, and already they're building the stigma that, oh, he's dumb or he's not smart, he can't keep up. And then in third grade, some children repeat, but it's a good idea not for that to happen. So we can get them extra help with tutoring or extra help at the end of the school day and things like that so that they can keep up. But that's a problem, and because of that, it leads to behavior. So these kids are lined up by the principal's office, and they're not in the classroom learning what their peers are learning, which is bad news in the first place. But they could do better if we recognize the problem and we get them some extra help and spend some extra time, because they can get it. They will eventually get it, like their
Excellent.
peers do.
So, like, we go back to what I was just saying before, all isn't lost. We're able to help, we're able to get them back on track.
Right, right. Because I know the thing that is so horrible is sometimes then when they get into high school, they're so frustrated. They have reached their potential. They can't keep up. They drop out of school and then sometimes get involved in crime and gangs. And that is, look at the lives that we've, lost. And they're not able to have a family, have a productive job. And it's not through fault of their own. It's where they were living and the exposure to lead. They didn't want that. So we want to make it better for them that they have a productive life. We do something about it early on. 1 and 2 is good if we can do this before they're 6 because the brain is developing then.
Sure.
And it's good. But so many children get missed that I really am concerned about that grade school group.
Okay.
Dr. Wood has given us some great answers on what to expect on the reduction of blood lead levels. And I want to say again, just because your child tested positive for lead poisoning doesn't mean all is lost. You can reduce your child's blood lead levels taking the appropriate steps and interventions. In part 4, I finished my interview with Dr. Marilynne Wood and we discussed minimizing exposure to lead dust and should your siblings be tested. My name is Anthony Weaver with the Lead Paint Detectives. You can find more lead-safe resources at leadpaintdetectives.com. You can find me on Facebook under Lead Paint Detectives. And as always, like, comment, subscribe to my channel for more lead issues.